Hello, it's Elena from Well AI, and today we will discuss the immune response of COVID-19 patients. I prepared a review of an article that got published in 2020, and it was published by physicians who treated patients with COVID-19 in Wuhan, China. So this article may answer some of the questions that you may already have in your mind. First, why COVID-19 is so dangerous for older adults and people with serious underlying medical conditions. Is it possible to develop immunity for COVID-19? How does the immune system react on COVID-19? Why do physicians use antibiotics to treat severe cases of COVID-19? And in the end of this presentation, I would like to discuss the further direction of the research in this field. So the first question, why older adults and people with serious underlying medical conditions got severely affected? Here you can see two pie charts for chronic conditions and hypertension as the example of one of the chronic conditions. So as you can see, 73% of people with underlying chronic conditions, pre-existing chronic conditions, tend to develop a severe form of infection. And with hypertension, it's very similar numbers. 78% of people with hypertension tend to develop a severe type of infection. So, but why it's like that? Actually, there are two factors. First is weaker immune function in these populations, and second is additional damages that already have been made by previous pre-existing chronic conditions. Let's talk about a little bit in more details about weaker immune function. What do I mean by that? I mean by that a chronic inflammation process that already exists in any patient with chronic condition, such as hypertension, cerebrovascular condition, cardiovascular condition, kidney disease. This chronic inflammation is already there, and COVID-19 is making it even worse. Second factor is low sensitivity of immune system in those patients. Older people and people with comorbidities is additional diseases, previously existing chronic disease that these people have. By sensitivity, I mean that the immune system have different way of identifying the pathological agent. It's impaired in the process of identification. It can't capture, it can't recognize all the pathological agents that come from outside. Low reactivity means that the immune system doesn't have a strong response to pathological agents. It doesn't have as many and as bright reaction to external invasion. So next question that we would discuss is it possible to develop immunity for COVID-19? And this is a good news. It's actually possible. This article clearly states that the virus doesn't affect CD8 cells and B cells, which are the immune memory cells. These cells actually memorize all the processes that happened during the previous infection and help the organism to learn how to fight certain types of viruses and bacteria. So these cells not affected by COVID-19. However, COVID-19 affects T cells and especially CD4 cells, which are frontline fighters and the most competent fighters in the battle with any infection. So the most competent element of immune system got deactivated by virus. And this is very, very serious damage that the COVID-19 does to the immune system. So how does the immune system react on COVID-19? It reacts actually with hyperinflammation. What is hyperinflammation? Hyperinflammation characterized by two processes. It's increased reactivity and low selectivity and control. By increased reactivity of immune system, I mean that immune system as a response to the infection start creating this not specific fighters. Since all the competent cells got killed, it started giving more immature cells, which don't have a plan of how to fight the virus and where to start, and don't have a great recognition system to detect whether it's a pathological agent or your own cell. It also reacts with cytokine storm. Cytokines are chemical substances that can be very, very damaging to your own tissues. It usually have their own function in viral and bacterial infection. They destroy those organisms, but only after the navigation of more competent cells that in our case, of course, got killed by COVID-19. And another part is neutrophil proliferation. Neutrophils are also reactive cells. They also don't know how to identify the pathological agent. They just randomly select the target and attack. This is the non-selective immune response that we have. Another factor that make it even worse is that the lymphocyte decreases. We know CD4 cells got kind of deactivated. And also we do have less regulatory cells, which actually navigate all those immune cells in coordinating the response. So instead of a targeted planned action to fight the virus, our immune system is in chaos. It's in the state of hyperinflammation and doesn't know what exactly to do and how to react, and reacts with every possible tool that it has at the moment. Another question, why do physicians use antibiotics to treat severe cases of COVID-19? This question is actually very important because a lot of people think that why to give people with viral infection actually antimicrobial drugs? And it's pretty understandable. However, there are some hidden mechanisms that can explain this type of treatment in COVID-19 infection. Among them are immune system dysregulation. So since the immune system is in chaos, it's less selective, it's less active, it can deactivate other pathological agents. Then it's massive damages to frontline responding cells, CD4 cells, T lymphocytes. They got affected first and they can't help in this situation. And also this gives the opportunity to other bacterial agents or viral agent to invade our organism. And tissue organ lesions due to this cytokine storms, due to all this non-competent cells actions, there can be your own tissues and organs got affected. And unfortunately, this is the gates for bacteria. And in this sense, antibiotics is very important in treatment of any infection, and COVID-19, of course, because it has so many mechanisms to dysregulate our immune system. So what are the questions that we still have after reading this article? So first, even though the immunity can be formed during COVID-19 infection, it's unknown how long would it last. So those cells that actually memorize the whole scenario of the infection and learn and help our immune system to learn and respond to similar stimuli in the future, it is not known how long they would remain in the circulation and how long they would memorize, think, have this information about this processes. And another question that remains is hyperinflammation caused solely by COVID-19. And this is due to the design of the study. Even though it's a pretty big study of 451 participants, it's a cross-sectional study, which means that this study has been done in one point of time. Doctors didn't follow up patients for a longer time. They took only one blood sample and they didn't take it several times. And that's why in this situation, we barely can say that this caused this. And this is the only factor for that. So we still are not very sure about other factors that may play a role in hyperinflammatory processes. And this is hopefully the future direction of research on COVID-19. Thank you so much for watching. I appreciate your time. Thank you.